Hi, my name is Leah, and I chose to do a compare and contrast of the Australian healthcare system with the US healthcare system. So I felt like the best way to kind of provide some context for the compare and contrast is to go through the history of the development of the two systems. So if you proceed to slide 2, we can start with the US healthcare system. All right, on slide 3, we start with the early healthcare. In the 1900s, healthcare was unorganized, it was unregulated. Most physicians worked on house calls. It was less formal than what we would experience now. There was pretty primitive technology. To put it in perspective, it had been just 50 years since the understanding of immunology. So, you know, that's pretty basic as far as medicine goes now, but they were still exploring that. 21 years since the invention of a blood pressure monitoring device, which we pretty much take for granted now. 13 years since the discovery of the X-ray, which is fabulous and basic in healthcare as well, but that had all just began. And even in 1910, it was the first drug treatment they discovered that heals the patient without harming the patient. So killing whatever it is they're trying to kill without actually killing the patient with it. And then citizens, they focused more, if they became ill, they were more concerned about whether or not they can go back to work. They were concerned about missing wages or missing payment. They were not as concerned about the cost of healthcare like we are now. All right, proceed to slide 4. The AMA membership rapidly expanded. Lots and lots of new members, which was great because that is whenever they started to create some legitimate standards for physicians. So anybody can't just practice medicine. They had the Council on Medical Education Standards to make sure that medical schools were qualified to teach what they were doing, that they were teaching appropriately, that the entrance requirements were appropriate. So it basically, applied the rules and regulations to the profession that they needed to keep the public safe and well. So the American College of Surgeons formed as well during this time period, and that's where they began the hospital accreditation as well. At first, I want to say it was like 13% of the hospitals passed the accreditation, which is absurd. But it was only a short few years later that that significantly increased, not only the amount of hospitals that they were looking to accredit, but the amount that actually passed it. So I think this is a period that really started to structure healthcare and our expectations that we have today. The beginnings of insurance. In 1929, there was a group of school teachers in Dallas that contributed 50 cents a month to a local hospital. In exchange, it was a guaranteed up to 21 days of inpatient care if need be. So it was kind of like the basics for what would become insurance at that point. It was also beneficial to the hospital as well because during that period of Great Depression, they needed the steady income. Definitely a mutually beneficial agreement there. Shortly after, Blue Cross network of plans was formed. Shortly after that, Blue Shield came. I did not know that they had been around that long, but that is where our Blue Cross Blue Shield came from. After World War II, the National Labor Relations Board ruled that insurance benefits could be used for employment negotiations. So if there were employer-offered insurance benefits, they can legally use that to negotiate and kind of consider it as a compensation like we do today. And the IRS deemed that the employee health benefits were tax deductibles for both the employee and the employer, so that was definitely an incentive there as well. And Kaiser Permanente formed. Kaiser did not start off that big. It was just a doctor with a mutual beneficial agreement with a gentleman who owns a shipyard. And then after World War II, the employment in the shipyard drastically decreased. They did not need them anymore, and then therefore the doctor who was treating all of the employees through their agreement he didn't have as many patients, so he was going to go back to private practice. But he liked the new method of care that he was able to provide because it did lay the foundation for the HMO plan. But if you're familiar with Kaiser Permanente, they are now huge. And I used to work disability claims. Sometimes even getting a person on the phone is difficult. They are massive over on the other coast. All right, over to slide 6. Medicaid and Medicare formation that came after in 1965 provides health care to those 65 and older and lower income citizens. Today, Medicaid's utilized by 39 million Americans. So I know I've utilized it before, and it is a godsend. Sometimes, it's scary not having insurance here. On slide 7, the health maintenance organizations. So that was termed in the 1970s, and then there was the Health Maintenance Organization Act in 1973. So what that did was it provided grants and loans to expand the HMO coverage, and then it also mandated that employers with 25 or more employees offer insurance from the workplace. So the HMO expansion, however, and then also the rapid development of technology, it did drive up costs as well, which we still experience as an issue today. All right, so slide 8, we have Australian healthcare. They also started out with a very unstructured healthcare system. So the Commonwealth was established. There's basically just private insurance. The Commonwealth Department of Health was even established in 1921, but their primary duties were to care for war veterans and to quarantine those that were ill and contagious. So they really didn't provide much of a public service beyond that. Then in 1953, there was the National Health Act, which highly subsidized private insurance. The goal was to take the price pressures off of the citizens. Unfortunately, it was not effective, and years later, nearly 1 million Australians actually experienced hardship due to the cost of insurance. On slide 10 is where they introduced universal health care. So in 1973, the Health Insurance Commission established Medibank, which was introduced and then dismantled a short few years later. It did not stick around long, but public universal healthcare did come back in 1984. It was essentially the same thing that was dismantled by the opposing political party, except they decided to call it Medicare. So they used our word. And while we're over here arguing over whether or not health insurance and healthcare is even a right to our citizens, they're over there using Medicare and building a better system. So it's funded through taxation. If you did not purchase private insurance, you pay 2% of your income to fund the public health care. You pay 3%. If you did purchase private insurance, then you pay the 2%. So you get a slight deduction if you've purchased your own additional supplemental insurance. It is highly favored. The approval ratings for it were phenomenal when they did relaunch it. In the 1990s, the government subsidized private insurance in efforts to drive down the wait times. So, we're seeing fairly quickly, it's easy to make a specialist appointment here. They were having difficulty with that. So, in efforts to drive down the utilization of the public facilities, they subsidized the private insurance so that people would go to private facilities. So 40% of the population in major metropolitan areas carried the private health insurance, the supplemental. There was a greater demand for the private facilities, though, which of course drove up premiums, and now Australians today are concerned over whether or not it's even worth the value to purchase the additional insurance. All right, moving on to slide 12. I have a side-by-side of the United States and Australia. Obviously, we have an entirely private healthcare, while Australia has a very unique mix of private and public healthcare. Therefore, their entire population's insured. It's a wonderful thing. In the US, 8.6% of our population is uninsured. We spend an average of over $8,000 per person annually on healthcare, which is crazy to think about. The taxation over there, like I said, the 2 to 3%, I mean, you would have to be making some hefty large figures for 2 to 3% of your income to be $8,000. So you could kind of see the price difference there. Preferentially, I would rather be paying into the 2 to 3%. With that being said, they only use Australia only uses 8.9% of the GDP for healthcare, as opposed to our 17%. But what's interesting is that we even charge more for procedures. We utilize more resources. We perform more tests. I think a lot of that is doctors trying to avoid malpractice suits, but it's not efficient and it does drive up costs and get pricey. But we're not all bad. We are the world leader in research and cancer treatment. So for like the 5-year breast cancer survival rate, we're the top one. We're the best. For research, innovation, it does not take long for the FDA to approve new things. That's a whole nother story, not always a good thing. But we are great there. And we do have the low wait times. So most people are able to be seen by a specialist within 4 weeks. Most people are able to get whatever surgery they need within 4 months. And those are very reasonable timeframes. But Australia does have the higher life expectancy, more physicians, more hospital beds, lower mortality rate, higher life expectancy by 3 years, which is pretty substantial. So, in conclusion, the US has not embraced the universal healthcare idea. Even as I was creating this PowerPoint talking about it with my dad, obviously I'm very pro for universal healthcare. I've used it in Australia. It was a fantastic thing. Getting a hospital bill that's only $180 as an American is fascinating. But, you know, I feel like culturally they were ready for it. For instance, like Great Britain, whenever they got their public healthcare system, it was right after World War II. And if you remember, like, kind of how the nation felt after September 11th, and they came together after a tragedy, a hardship, and they just wanted to help each other out as a community. That's kind of what Great Britain did with their system, and I just don't feel like we've gotten there yet. That and like the Cold War and our, you know, anti-communism sentiment, fear of socialized anything, you know, I just feel like all these things are kind of pushing against our progression towards that direction. Statistically, Australia does excel ahead of the US in pretty much every statistic in our book. It is a more efficient and effective system if you're looking at the numbers. But both nations do feel financial pressure from out-of-pocket expenses. I think in different ways, but they do as well. So their system by no means is perfect, but I think it is a really unique mix of the public and private healthcare. I think it's very effective. You know, like why pay for a Mercedes when all you can afford is a Hyundai? So maybe somebody only needs that public health care, or maybe if somebody wants to, you know, get different treatments or different facilities or prefers a doctor, they can purchase that private. But I like the system for the fact that it does provide for everybody as a standard. So that concludes my presentation. Thank you for your time, and everybody have a happy Thanksgiving.